Joining us right now is Dr. Ashish Jha, Dean of Brown University's School of Public Health. Good morning. How are you doing?
Good morning. I'm well. How are you?
Good, good. Thank you for joining us. Now that Christmas is behind us, what are your concerns with families gathering, family and friends gathering for the New Year's?
Yeah, obviously a lot of infection happening around the country. What I'm worried about is people basically not being careful at this moment. I do think it's safe for people to gather, but the best way to do it is make sure everybody's vaccinated, at least all the adults are, and then use rapid tests if you can get them. That combination makes it much, much safer. I'm worried about people not only not doing that, but I'm also worried about large gatherings, which are just very difficult to pull off right now without causing a super spreader event. So doable to gather, but you got to be careful.
I live in Los Angeles. I recently worked in Washington, D.C. I'm now here in New York City. You see these long lines around blocks of people trying to get tests. What do we need to do to improve the testing situation?
Yeah, first of all, this is not where we should be 2 years into the pandemic. I really think we have not done enough to set up a testing infrastructure our country needs, and I'm disappointed by that. What do we need to do? First of all, we need to ramp up our ability to get those rapid tests out. I was happy to see the president say that we're going to have 500 million tests available to Americans in January. Obviously, we all wish it had come in December. It would have made an enormous difference. We also just have to have these tests get cheaper over time, and I think that they should be widely available. At this point in the pandemic, we should not be at a point where it's hard to get a test.
Dr. Jha, Omicron is leading to so many breakthrough cases. What should people know, or what should we be telling folks who are already vaccinated and those who even have their boosters?
Yeah, this is what's really striking at this moment is we are seeing breakthrough infections at pretty high numbers, less if you're boosted, but even among the boosted. The good news is if you're vaccinated, and particularly if you're boosted, the infections tend to be very, very mild, and they tend to be more like a bad cold. So what I would say to folks who are vaccinated and boosted is try to be careful, avoid getting infected, but if you do, you're not going to end up getting particularly sick. The real problem is the fact that there's still a lot of Americans who are unvaccinated, and when they get infected, unfortunately, they're really ending up in the hospital at much, much higher rates. And that's what we have to pay attention to.
Dr. Jha, what is your view on the current isolation guidelines? Do you think we need an overhaul?
I do. I understand the 10 days from the CDC, but I think that that's probably too long for vaccinated, particularly boosted people. What my theory has, or my prescription on this has been that it should be shorter. It should be 5 days, followed with a negative antigen test. So not just 5 days alone, because some people are still contagious after 5 days, but 5 days followed with a test that's negative should be pretty reasonable for letting people stop isolation.
I do have a question about those antigen tests. I've heard that sometimes you have to take multiple tests in order to get a result.
Most of the times you should not. I mean, again, if you don't, obviously there's how well you do the test, but they're pretty straightforward to use. They tell you whether you're contagious at that moment. So if you're going to go visit someone, you may want to do serial tests to make sure you don't pick up the infection or turn positive over time. But they work pretty well.
That makes sense. Dr. Ashish Jha, thank you so much.